Member of Parliament for Central St. Mary, Dr.Morais Guy, took the government to task on Tuesday for what he sees as the poor state of the country's healthcare system. He's avowing fixes under a PNP administration. Making his contribution to the sectoral debate in the House of Representatives, Dr. Guy described a system in crisis and on the verge of collapse.
The system stands at a crossroad, battered by neglect, inefficiency, waste, and lack of meaningful accountability. Despite the spirited defense given a week ago, the reality is that Jamaica's public health system is at a critical breakpoint. Equipment failures, industrial action at every level of staff, overcrowded, deteriorating facilities have become the daily reality for our people. Many Jamaicans visiting hospitals for needed or emergency care have spent days and weeks fighting to be accommodated with a bed. Some have been forced to remain on stretchers, in wheelchairs, on chairs and benches, and yet others have had to make whole ground their bed, even if not rock stone their pillow.
Mr. Guy's assessment is out of sync with the depiction provided by Portfolio Minister Dr. Christopher Tufton just last week as part of his own sectoral presentation. Dr. Tufton described a system which, while still hobbled by challenges, is in the best state it has been in over a decade. However, Dr. Guy, who made what will most likely be his last ever contribution to the lower house, says a PNP administration will deliver better health care for Jamaicans.
The People's National Party is committed to a new vision for healthcare, one that puts people, not buildings, first. We'll pivot away from photo ops for medical projects and ribbon-cutting ceremonies and focus on enhancing service delivery across all clinics and hospitals island-wide. Every operating theatre from KPH to Cornwall Regional will be made fully functional. No more years-long wait for surgery. We will move from ribbon cutting to cutting hernias and saving lives. And Mr. Speaker, even as we await the promised land with the announced 27 new theatres, the government must get the existing ones working efficiently and consistently.
Dr. Morais Guy, a Member of Parliament for Central St. Mary. Meanwhile, Dr. Tufton gave an update on the state and availability of medical diagnostic equipment across the public system.
I did say that in 2024, some 703,000 imaging tests were conducted, and over the past year, we have acquired some 17 additional pieces of diagnostic equipment. We are in the process currently, Mr. Speaker, of acquiring through a new policy arrangement, leasing arrangement, some 16 additional pieces, including 10 CT scans and 6 MRI machines. And so that is to come. The current state of affairs, we have 5 CT scan machines. The number at UHWI will double shortly. We are well on the way for the installation of two additional CT scan machines. The public can expect a 4-fold increase in the number of MRI machines in the system, in addition to the one currently at the University Hospital of the West Indies.
The health minister stood firm on his statement that the system has improved since 2015.
And just to conclude by saying, the position is still the same. We are better off today than we were in 2015 in terms of diagnostic. More in the system, which means we are making progress. Any commentary that ignores that context is an incomplete commentary on what has transpired. Just referencing what the opposition spokesman and finance said. Not that this is the reason for this announcement. I just wanted to clarify for absolute transparency, because persons have been asking, where are these equipment? And so I decided to outline where they are.
Dr. Christopher Tufton, Minister of Health and Wellness. He was speaking in the House of Representatives on Tuesday. Member of the JLP's Communication Task Force, Merlin Morgan, says the early rollout of the National Housing Trust's increase in loan limits is another demonstration of the Holness administration's commitment to easing the burden of prospective homeowners.
This administration is always in the business of seeking to have the Jamaican people benefiting from the dividends, as it were, of our collective sacrifice over the years. And so there's never a good time as the president to do what can be done to ease the burden on our people and to make the dream of home ownership. For example, in this case, we're discussing an acceleration in the borrowing ceiling at the NHT. And the truth is, whereas it was scheduled for July 1st, as a part of the government's accelerated and demonstrable commitment to easing the plight of persons seeking to access housing solutions, we believe that fast forwarding it is in good order.
The changes took effect June 16, 2 weeks ahead of the previously announced July 1 date. Meanwhile, Morgan says the government's $1 billion one-time solidarity program is set to be rolled out in the coming weeks.
A matter of days or weeks from now, you will have a solidarity program essentially launched where persons are going to be able to essentially receive $20,000 up to 50,000 persons from the government, because they too have endured the burdens when Dr. Peter Phillips and the PNP of old were levying 60 billion in new taxes on our backs. Those people who are not on path, they are not getting an NIS benefit in terms of pension and so on, and they too deserve some form of support and mainstreaming, as it were, in terms of the dividends of the successes.
We have to cut it.
Marlon Morgan, a member of the JLP's Communication Task Force. Under the Solidarity Program, cash grants of $20,000 will be provided to 50,000 vulnerable Jamaicans. The beneficiaries will be persons who aren't enrolled in the Program for Advancement through Health and Education Path, Social Pension, National Insurance Scheme, or the Reverse Income Tax Credit.
Health Minister Dr. Christopher Tufton has warned that hospitals that fail to adhere to World Health Organization WHO infant health stipulations will lose their baby-friendly designation. The Health Minister gave the warning at yesterday's national certification ceremony for the Baby-Friendly Hospital Initiative. 4 more hospitals in the public health system received the designation yesterday. Tufton urged hospital staff to ensure that best practices are followed and become the standard.
You can lose the designation if you don't maintain it. So it keeps you on your P's and Q's, for want of a better word or term, and it requires you to ensure that those best practices are followed. But you know what's going to happen over time? As you follow those best practices, it's going to become habit. It's going to become habit. And it's going to be contagious, because infection prevention and control, for example, is a logical consequence of baby-friendly. It's the convenience of it, it's the promotion of breastfeeding, but it's also setting an environment that is conducive to give you the best possible results. And that's really what we hope for, giving our patients, giving our staff the opportunity to provide and create an environment for the best possible results. That's what health and wellness should capture.
Health Minister Dr. Christopher Tufton. The National Baby-Friendly Certification Ceremony is part of the national strategy to promote, protect, and support breastfeeding in line with the global recommendations and national health policies. The WHO and United Nations Children's Fund, UNICEF, launched the Baby-Friendly Hospital Initiative to promote, protect, and support breastfeeding by ensuring health facilities provide optimal care for mothers and newborns.